Dear colleagues, we are about to start our webinar. We are waiting for a couple of additional colleagues who are still joining. We have a lot of people today that came to see the latest news from us, from VISEVEN. Let me mute myself for additionally 2 minutes and then I start again. So, dear colleagues, let me start this webinar. I see a lot of guests. Thank you so much for coming. Thank you so much for dedicating some of your time to this interesting topic. And today we are going to talk about self-detailing, which is the augmented reality of approved email. Well, the slogan and the name itself is intriguing a little bit, and you will understand why. First of all, let me present myself. My name is Alexander Dudinets, and I am Chief of Business Development Officer for VISEVEN. I've spent more than 20 years in pharma industry. I've been doing different roles and a lot of successful projects. And now I am sharing with you the best practices in digital world. We're going to talk about different topics today. First of all, we will cover some market trends. We will touch a little bit the use of digital channels. I will share with you the best practices in approved emails, and I will talk a little bit more in details about self-detailing as the next step of approved email. Having this huge opportunity to talk to you, let me invite first of all to share your comments and questions if you have some in the questions section of this webinar. You can find this to the right of your screen. So let me start with the statistics first. Market trends. Probably you know that the total population on the globe is close to 8 billion people, and half of that population lives in cities. Nowadays, like almost 70% of this population basically use mobile phones, and which is really like a huge penetration figure. Among them, 5 billion people, it's about 60%, are active internet users, and only some of them are active social media users. We will not cover social media users now because we have strong regulations in pharma industry. We will talk a little bit about our physicians first and the reps, how they're dealing with physicians. But before jumping to the physicians' numbers, I would like to touch a little bit this split of traffic by devices. This also demonstrates a huge trend. You see that 53% of traffic is going through mobile devices. We also see that 44% of traffic is going through laptops and desktops. But this is decreasing by almost 77%. We see that tablet computers It's just 3% of the traffic share, and it's decreasing a lot and a lot. What it shows us? It shows us that our users, they have bigger screens now. They have smartphones, and this is the format that allows them to be on the web, that allows them to interact with colleagues and friends and families through the mobile device. And let me ask a very provocative question. I'm talking now to pharma audience because you are the biggest part on this webinar. Who of you design and start multi-channel and omni-channel campaigns for smartphones for mobile users? I'm not sure that everyone does that, but this is a question why. Let us talk a little bit later about this. Let's talk about the usage of digital channels in pharma, and particularly in doctors in HCP area. With this COVID news, with this quarantine time, we saw a huge impact. And this is just a very quick study of IQVIA that demonstrated during the pandemic, during the quarantine time, this demonstrated that there was a huge fall of face-to-face activities, which is green bars you see on the slide. The huge growth of e-detailing and e-meeting activities, and also other remote methods of communication. This was a very short moment that influenced the strategies of the companies. And what they are doing now. So according to the latest Accenture survey, HCPs want the human connection with the sales reps in the future. This is the screenshot that I took from the LinkedIn today from the, this is live. I mean, this just has been issued. So they still want the human connection with the sales representative, but in a different way. So if we look at the numbers, we can see that 48% of doctors, they prefer a mix of virtual and in-person connection. 39% of doctors, they want all meetings to be virtual. Only 10% of doctors still prefer eye-to-eye, face-to-face contact, and only 3% of our HCPs, they don't want any meeting. So this clearly demonstrates the shift in the behavior of the HCP. They had first digital contacts, and they like it. They even find some benefits. So when they were asked, what are the key benefits to you of having discussions with the sales representative online over the phone compared to face-to-face discussion, they mentioned, this is easier to reschedule, this fits into my work schedule better, this saves time, this is, they are being able to download information, any materials from online. This allows them to discuss information at home. So they see a lot of benefits in remote communication. And pharma world is using that trend. So basically, what we see, these are the top preferred channels of communication at this moment. And we see the biggest share here is the email channel. So 81% of HCPs, they prefer, first of all, email communication, then medical news and clinical publications. And only after that, online physician communities, e-detailing, mobile applications, etc., etc. So the email channel has become a major, I would say, legally approved, legally and technically available for the medical representatives to contact their HCP. And pharma is using that channel a lot at this moment. And this is basically the benefit, the good thing, and the worst thing, because Pharma is basically burning out this channel, because they are sending a lot of email campaigns, sometimes not connected. The doctors are basically bombarded with a lot of emails, sometimes not personalized, poor quality, redundant information, and they become very tired of this email channel. But the good thing is that many companies started to think, what can they do better about this channel? And here, the global trend is very easy to understand. Users are more and more interacting with digital channels and devices. The solution is very obvious: mixed communication model based on customer preferences and behavior. And the tactics is to use mixed model, which is face-to-face plus digital. So we still keep the medical representatives as the key channel of communication, supporting him with digital campaigns. At VISEVEN, we differentiate our customers by their evolution stage. Everything, the digital story in Pharma starts with the CRM system, CLM strategy, implementation of that strategy, while closed-loop marketing. Once the organization starts looking at the numbers, then they start experimenting with digital channels, and this is already the step number 5, which is multi-channel implementation. They start first campaigns through emails, through messengers, even through websites. And then some of the companies and affiliates, they come to the stage where the omni-channel marketing is implemented, where all the channels are working as the unique system. But the trend is obvious. I mean, Pharma is dreaming to jump from multi-channel to omni-channel strategy. For those who still don't see the difference, I would repeat the difference of those two stories. Well, the multi-channel story is when all channels are available to the customer but not connected, and all digital and not digital campaigns are executed in parallel without any interconnection. The omni-channel story is when you have the marketing automation system integrated with all your additional channels, and that system works as one. I mean, every next message depends on the previous. I will give you a real example. When the medical representative is coming to see the doctor, he's inviting him to participate in one webinar. This is already the next channel. Once the doctor gave his consent to share, to use his email, then the invite is sent to the doctor is registered. One day before the webinar, the doctor receives the SMS. 5 minutes before the webinar, the doctor receives the SMS. After the doctor attended the webinar, he receives the follow-up email, and then the rep comes again. So we have seen at least 5 channels working as one system, just to invite doctor for the webinar. This is already omni-channel strategy. I hope this example shows you the difference. So a lot of companies, they basically use the approved email, but they started to experiment. Let me show you a couple of best practices for sustainable approved email strategy. First of all, we should stop doing broadcast, not personalized email campaigns. Everything should be personalized, because doctors are losing the contact. They want to keep it, and they like when someone is personally talking to the physician. So we do recommend to use personalized dynamic content. The content should be flexible. I mean, it should not be really expensive to produce email templates. So having these email templates as a basis, the company should be able to produce a lot of different emails for different campaigns, just using the flexibility of the template. And the company should also use extra features of Viva, such as email fragments. This is basically, in briefly talking, this is basically the possibility to give to the medical representative some options that the rep can choose from in order to send a personalized email to the physician. Just to showcase you the example of modular content, I would show you how we understand the email. We need to create emails based on pre-designed templates. It should not be like one-time job. It should be something that you can reuse many, many times. And therefore, we basically split the email into several parts, which is header, body, and footer. And then for different purposes, for different use cases, you can basically change either header or body or footer. These are some examples. So you can keep the header and footer, but the body can be different for different types of physicians. Some of them, they prefer just scientific numbers, and therefore you can show them like results of the study. Some of them, they prefer real pictures of patient profiles, and some of them, they only like visualized content. I mean, some links to some video resources or websites. So this is something that we do recommend nowadays to make the content more interesting for physicians. I hope this is clear. The types of dynamic content can be, well, a little bit different. First of all, this is variable substitution, where we call it snippets, when some parts, some personalized data can be changed, like username, location, etc. So you send one email to everybody, and the viewer system puts the right doctor's name, his location, and even the time of the day. It can be personalized in this way. And then content insertion, where it's much deeper level, where some parts of the email can depend on the psychotype of the doctor, even can depend on the place of work, etc., etc. So the huge blocks of the email can be different just because of some additional information. So this dynamic content is in your email campaign will help you to win the competition for brand loyalty and increase revenue and save time. So now we're coming to another recommendation for approved email strategy. Before going to self-detailing itself, I would ask you a very simple question. Well, it's a little bit provocative. Do you believe in life after death? Very strange question, right? So some of you think that there's life after death. Some of you think that there's no life. This is just only the time that we spend on Earth, and that's it. The same I would say about emails. What happens with email after we send it? After we send it to HCP? The best thing we can know if it was open, if it was deleted, or if someone clicked on that email. That's it, nothing else. But there's life after that. We can know more after the email has been sent. We can understand what was the doctor's behavior. Did he like your content? How much time he spent there? So there is life. And let me talk a little bit more about this life after email has been sent. So self-detailing is the practice when the representative sends the HCP approved email with a little link to view a presentation themselves. This session KPIs, questionnaire answers, feedback is going to be collected automatically and synchronized back to the CRM system. So the only thing the rep has to do is just to send the email to HCP. So next step. This self-detailing technology can be used both in multi-channel story and omni-channel story. This is very complementary to every strategy. So when we talk about multi-channel story, let me show you a very simple setup, which is very common on the markets in different countries. And this setup is basically about the medical representative and the HCP. The rep is usually equipped with some channels. Well, first of all, he's the channel himself, face-to-face visit. Then he has, in best case, he has approved emails. He has some remote visits. He has some contacts with his favorite friends, HCPs, via social media, and he can send sometimes the SMS and messages. So what do we propose here is that through all those channels, we can share a link to the presentation with the HCP. And after the doctor reviews this link, then the KPIs are collected back to the CRM system of the medical representative. So this was the story of multi-channel. Then, if we talk about omni-channel strategy, the key role in this setup is taken by marketing automation platform. In many cases, this is Salesforce Marketing Cloud. This is basically in the middle of the screen. This marketing automation platform orchestrates all the channels connected to this platform. And as one channel, there can be self-detailing. So the platform can send the link to the HCP, and then if we look at the customer journey, we can see a lot of touch points like email, like rep visit, etc. And one of these touch points can be a remote call. So this channel can be beneficial to your omni-channel strategy as well. Let me talk a little bit more in details about the flow. What do we propose? How it can work actually? First of all, on the first two steps, the agency produces the content, I mean the email template and the slide deck, produces and uploads this to Pharma landscape. I mean, the content is becoming available for Viva Vault approval. Once the content is approved, then the email is pushed to Viva CRM, and the medical representative can send this email to his physician. And this is the end of the story for nowadays for many companies. So after the email is sent to the doctor, nothing happens. We can only track what was the open rate and what was delivery rate. That's it. This is the end of the story. But due to the fact that we make a very nice link to the email, to the remote presentation, the doctor can click that link, go and see the slide deck, and then the information is synchronized back to the CRM system. Let me show you the real case, how it will work. Imagine that your HCP receives an email like this. This is a very nice email with the call to action button. Well, the natural behavior of people when they see this play button, they usually click it. So the doctors will do the same. The doctor will click this button and he will jump into a very nice interactive presentation. And this will not be only nice. There will be some differentiators comparing to the regular e-detailer. So first of all, we do recommend use voiceover for this presentation. So we all know that some of our medical representatives, they not always pronounce the messages in the right way. Some of them basically don't remember the key messages. Some of them don't tell the whole story, just favorite slides, etc. Using this automatic voiceover, every slide is going to be pronounced with a very nice voice of a dictator. So if the doctor is at his workplace and he's not allowed to put anything loud from his smartphone, then he can mute the presentation, and then subtitles will go below the slides, and they will repeat what the voiceover was saying. Another differentiation is that on these slides, we do recommend to use clear navigation buttons and clear interactive menu. So the doctor could choose himself the topic he wants to listen about himself. Not the rep-guided presentation, but the doctor navigates through the slides himself. And another thing that is differentiating the presentation is that we can request a feedback form by the end of this slide deck. So we can ask the doctor to evaluate the presentation, the slide deck, and to ask the questions if he has some, which is not always possible during a regular face-to-face visit. You do agree with me? It would be strange if by the end of the visit, the medical representative would ask the doctor, do you like my visit? Can you please evaluate this, etc., etc. It would be a little bit ridiculous. So in this type of communication, it is still possible, and then you can receive a real feedback of the physician. So what kind of KPIs can we collect? A lot of KPIs. So we can collect through this presentation, we can collect which type of device, software version, time zone, etc., etc. We can collect digital KPIs, even some consents from doctors, email, his signature, even what type of smartphone he is using, messenger type, etc. It can be useful for additional omnichannel communication. We can collect rep performance KPIs, we can collect content KPIs, what was the start time, end time, interaction on the elements on the slides, and even some custom KPIs, such as how many patients and how loyal the doctor in prescribing our products, what is the competitor idea in the head of the doctor, different treatment, different therapy he's using. So which key messages were delivered, even the NPS that I just demonstrated. So a lot of KPIs can be collected. So remember what I said, there's life after death. Sorry for this joke, but after you send the email, this is not just open rate, click rate, and click-through rate. So it's just a lot of additional information that you collect more and more using this technology that we call self-detailing. So what are the benefits of self-detailing? First of all, self-detailing is available anytime at any device. So you are not anymore attached to the rep visit to his device. Once you send the email, the doctor can review the slide deck anytime at home from different devices, and with the full voiceover, like almost human contact. So like this, you can use different pattern of slides and time spent. You can see the real interest of the HCP and his reaction. You can request a feedback form and know his opinion. The key messages are delivered, no chance to miss them. KPIs are collected. So duration of the slides is usually higher, but one of our recommendations is not to push through this channel. we do recommend to prepare very short stories, like 3 to 5 slides, in order not to make the HCP tired. So he should be interested in receiving more and more information like this. So another benefit is the open navigation menu. So the doctor selects himself what is he going to see next. But some of you may ask me the following. I haven't seen yet the questions that you put on the question bar, but some of them would ask me, well, this additional channel cannot replace the real medical representative. Even the virtual meetings, it's not a full replacement of the rep. No, we don't see, and we do not position this channel as the replacement. It's not instead, but in addition. And there are some cases that can demonstrate to you some use cases where this technology is really important and you can benefit from. First of all, after face-to-face call, medical representative can share the information with HCP, proposing him to review the information that he was not able to go through. For example, the doctor had no time. For some reason, he refused just to talk a little bit more. And then the rep can offer this option to share the slide deck via email. The same can happen after the remote call. After the virtual meeting, the rep can offer the doctor the slide deck for his next time review. The next option, the next use case is where you have a high target of face-to-face activities for the doctor, high call pressure, but you can mix some of these calls, you can replace them with self-detailing. So instead of going to see the HCP, you can send him a link. So approved email plus self-detailing in order to cover doctors in remote areas. So probably you have some target audience that is living and practicing in remote areas. You cannot reach them. This is the best way to visit them. And also some of the marketeers, they put a lot of products to be detailed during one call. For some of them, like 3 and 4 products to be detailed in one call is possible, but it's not always possible. So for these cases, it's strongly recommended to use self-detailing. And also, every marketeer is basically looking at the target audience that he's dealing with. There are some small groups that the marketeer cannot send the reps to. So those small groups can be covered through self-detailing only. And for some particular story, when you have a product launch and you want the market to know immediately about your product, so the self-detailing is the best case to do this. And of course, after the webinar, as a follow-up email, it's also interesting to for the HCP to see the materials. Some of the tips for self-detailing content creation. As I already mentioned, we do recommend very short presentations, very interesting, eye-catching. It should be really interesting story in order to have the attention of the HCP for the next time. We do recommend the voiceover. The doctor is missing now the physical contact. This can be a kind of physical contact that some human being is talking over the slides and is explaining the doctor what is on the slide. So we have to put some attention on the very important topics of your slide deck. It should be rich in visualization. I mean, the content should be bright and clear for the medical the customers. So the length of the content included should be defined by the HCP real need. No more, just what the HCP needs. The self-detailing demo. I put this slide on purpose. We would do a real demo now, but I strongly invite you to contact us, and me in particular. We can run a very personalized demo for you. So I will not be able to show it now, but I will do it in person for everyone who wants to see this demo. This was the end of my story that I wanted to share on behalf of VISEVEN team. This is a brand new channel of communication, very easy to implement, very sensitive to HCP professionals. They like it. This is the second life of your approved email. So this life after you send the email. And here I do invite you to ask questions if you have some, if you want to pronounce this or it's in written. So I see a lot of questions here. Will I share the presentation with the audience? Yes, you will receive the presentation in a separate link with the follow-up email. So someone is asking that the statistics on the preferences of email channel is not equal for every country. Do we have similar statistics for country by country? I would say yes, but in order to respect the entire audience, we presented some natural numbers, not talking about every particular country. So one of the question, what will be the landing page once the HCP clicks the link? There will not be a landing page. It's not the website that we are inviting the HCP to see. This is a full screen interactive presentation with the voiceover. This is kind of interactive presentation that the doctor is invited to see. The where the presentation is going to be hosted. So it's going to be hosted on the landscape that is very compatible with Viva or any other CRM system. So the doctor will be able to access this server or the link without any technical details. He will not need to click something in additional to log into something. He will not need to upload any specific modules or, I don't know, components to be installed. He just clicks the link and he sees the presentation. Full voice, full screen, full bright and color. Well, unfortunately, I don't have any other questions. If you want to ask a question, don't hesitate to type that, or please contact us directly. We will run another personalized session with the real demo of this particular channel. Dear ladies and gentlemen, thank you so much for finding your time and joining this webinar. That was really a pleasure to see so many professionals from pharma industry. Well, I was impressed really to see that many people interested in this technology. Thank you so much for your time. Keep in touch. Please come to see us again in a personal mode. Thank you so much. Have a nice day, and good luck with on your journey with HCP communication. Thank you very much.